The most important thing in terms of retinopathy is a regular eye checkup. If you have diabetes for more than 5 years, please get your retina checkup done once a year. And that's why you have to screen it. Now, how does the screening take place? In angiography, what was required was to inject a dye inside your vein. So there was an injection involved, a dye would go in, and then we would take flash photographs of your retina. So there's a lot of bright light coming into the eye, and it's not comfortable for the patient. We have the advantage that we are able to screen 130 degrees. So you can imagine almost from here to here, 130 degrees of retina, we are able to scan in a single shot. And if we montage these photographs, then we are able to do 220 degrees of retina, more than 180 degrees. So we are able to screen nearly the entire retina without any injection, without any dye, and in a matter of just a few seconds. So this is the advantage of the new technology which is coming in. We are very happy to say that we have been able to introduce it for the first time in North India. Now the next question arises, okay fine, so we have screened the retina, we've diagnosed diabetic retinopathy, what is the treatment? So the treatment is, number one, we try to give you medicines and eye drops to improve the condition of the retina. If that doesn't work, then we have to give injections to decrease. Typically injections are given to decrease the swelling which occurs here, which is the diabetic macular edema, and also to destroy, to kind of shrink these new blood vessels which have formed, which are abnormal vessels which I mentioned earlier, and that's the purpose of giving the injection. But the effect of the injection lasts about 1 to 1.5, maximum of 2 months. And so therefore, in a year, after some time, you may continue to require 3 to 4 injections every year, depending on the types of injections that are being used. To prevent long-term proliferation, finally, after the injections, we have to start with lasers. And we destroy the dying retina. That's what the lasers do. So that's the mainstay therapy for long-term control of diabetic retinopathy. And third thing, now if things have gone beyond a certain point, if there's too much of bleeding inside the eye, or if the new blood vessels are pulling the retina, causing a traction, then we have to do a surgery, and that is unfortunately something which has to be done only if it is required. It's a high-tech, complicated surgery, and it can be complicating surgery also. A lot of times we are able to clear the blood, or the entire eye shuts down, and the patient still continues to lose vision in spite of surgery. So surgery, like I said, is the last resort. We would rather not have to do it. We are not happy to see patients who are reaching the sad stage at which surgery is required. We would be much happier if you were able to find the patients at the earlier stage, and we are able to prevent this from happening. Please get all of the parameters which I told you along with diabetes, get them checked regularly, and please get your retina examined. Please get your diabetic foot examined, because why I'm emphasizing on these things are because these are often neglected and patients do not know, and this is the reason why we are trying to run this campaign to make people more aware of this problem, and so that they can get their regular examination done and prevent themselves from this world's largest cause of blindness. And that is what diabetic retinopathy is. Thank you so much.